Hello viewers, we will talk about a book which I wrote in 2013. Name of the book was Step by Step Arterial Surgery and it was published by J.P. Brothers Medical Publishers, India. This book is about all the arteries of the human body. I will briefly describe the chapters to you and then we can talk about in detail at a later stage. So basically the book was divided in 6 chapters. The first chapter was vascular trauma and it meant mechanism of injury in a vascular trauma. Now we have dealt with road traffic accidents, we have seen them happening all around us. How do we manage them? Do we know where the bleed is coming from? And where exactly is the bleed coming from? If we understand that, then we are able to control it. So the primary focus was not CPR or AVC or any other thing. The primary focus in this book is about the different arteries which can be injured and how do we treat them, repair them. I would like to add here that I am only going to briefly talk about these arteries. How to treat them and suture them is going to be the domain of a vascular surgeon. My idea is to introduce you to the anatomical aspect of our body, where all the arteries are. So that helps you understand where exactly you might find a large bleeder or a small bleeder, or you will be able to save the patient accordingly at your level. So it is a preparatory book to introduce you to the world of anatomy, which helps you answer most of the questions that pertain to injuries. First chapter is vascular trauma, mechanism of injury in vascular trauma. Second is neck. Neck includes the carotids, the subclavian artery and the axillary artery. Third is the upper limb, which is the brachial artery, radial artery and the ulnar artery. Fourth is the abdomen. Abdomen includes abdominal aorta, hepatic injuries, splenic injuries, hepatic portal system, portal vein. You have the testicular arteries and the ovarian arteries. Then you have superior and inferior mesenteric arteries. Inferior mesenteric artery specifically, marginal arteries, kidneys, adrenals, gonads. Salient features, vasculature of the pelvis, relations and the myopectineal orifice of Frocha. So these are the chapters which will be included in abdomen. Finally, we'll come to the lower limb. Lower limb will include external iliac artery, relations of the external iliac artery, femoral artery, popliteal artery and the posterior tibial artery. And finally, we'll briefly mention a small chapter on arterial suturing. So I would like to end the topic here because I wanted to describe to you what this book was about and what the individual sub-chapters in this book we'll talk about in later videos. I hope it has caught your attention and you will be following these chapters at a later stage. Thank you so much.